how to use Proviron most effectively. So, what are the benefits, side effects, dosing? Are there differences between an HRT protocol and bodybuilding?
All right. Well, first, let me categorize this and say that Proviron or Mesterolone is not approved in the United States. It's never been approved by Big Pharma in the United States. So I have no clinical experience with it personally as a user. And I rarely have anybody come to me in the United States because we can't get it here. You know, I mean, maybe underground people have come to me with it, but nobody's ever admitted to me that they're taking Proviron. So my talk for Proviron today is going to be based on my gleaning knowledge from the Testosterone Bible. And oh, by the way, in this huge book, there's one paragraph on Mesterolone. One. Okay. Also, Sports and Exercise Pharmacology. These are books that I had in my residency in sports medicine, and thanks for giving me the excuse to get back into them. Anabolic steroids in sports and exercise. Okay, so that's where I'm getting most of my what I'm telling you today, not and also from just experience dealing with some people in the bodybuilding industry. All right, so let me begin. Proviron, Mesterolone. It's been around forever. It's been around since the year my dad was born, 1934. So basically, it's been around since before testosterone. So it's got a long track record. Now, what is Proviron? It's a 1-methyl DHT. It's a derivative of dihydrotestosterone. And my research indicates that it's a very strong androgen, but a weaker anabolic agent. A strong androgen, but a weaker anabolic agent. Now, the 1-methyl group they put on the DHT protects it from hepatic metabolism. And because of that, it's not liver toxic. That's important for us, not liver toxic. Now, it's used primarily in the bodybuilding realm to increase androgen levels when dieting and as, believe it or not, an anti-estrogen. It has AI properties. It has properties similar to an estradiol, but weaker, but it has anti-estrogen properties. That makes it somewhat unique, in my opinion. I remember when I was in Kuwait, a lot of the bodybuilders there were into everything. And they would tell me that overseas, it was used sometimes to promote fertility by increasing luteinizing hormone, therefore increasing sperm quality and quality. I mean, sperm quantity and quality. So it's been used to enhance fertility because it increases LH, and by doing so, you have better sperm quality and quantity. Again, not approved for use in the United States. So let's talk about some of the side effects. Well, before I get into side effects, you mentioned dosing. My research indicates that it comes mainly in 25 to 50 milligram tablets. All right. The usual dosing recommendation by the bodybuilding world is initiate at 25 milligrams 3 times a day. Okay. Then after 1 or 2 months, you can drop it down to 1 to 2 tablets every day. So you start high at say 25 milligrams 3 times a day. After a month or 2, you can drop it down to just once or twice. And they recommend it 6 to 12 week cycles. So up to 12 weeks on, and then you need to take a holiday. All right. So it's a very well known drug in bodybuilding because it increases the anabolic effects of the other anabolics. Say, for instance, say you're on testosterone or Anadrol 50 or Anavar, and because this drug Proviron has a high affinity to bind with SHBG, by binding SHBG, you have more of the other anabolic hormones free. You free up more of the other anabolics, making them more powerful. So you can bind up SHBG, bring up the other anabolic levels of the other more potent anabolic agents. You can remember this is a weak anabolic, but has high androgenicity. High androgenicity means it has same side effects as testosterone, meaning oily skin, acne, hirsutism, and it's also well known to flip lipid chemistry in a disfavorable fashion. In other words, it's going to decrease HDL and increase LDL and increase TCAL. Okay, so you got to be careful. So because of that, you have to monitor the lipid profile, and it's recommended that you never take it by itself. Just like I recommend you don't take nandrolone unless you're doing testosterone with it, because remember, it's not aromatized. Mm-hmm. You're not getting the benefits of estrogen by using this anabolic. So you can use it with other drugs such as testosterone. Okay, now the interesting part of my research is that there seems to be a level where if you use no more than 150 milligrams a day, for some reason, the 150 milligrams is the cutoff. So up to 150 milligrams per day, no significant testosterone suppression. Mm. But if you use greater than 300 mgs a day, significant testosterone suppression. So my recommendation, you use it in addition to other anabolics, such as you would with, nandrolone with testosterone. You can use this one with testosterone, but don't go more than 150 milligrams per day. You're not going to, because again, more than 300, there's a gap between 150 and 300, but up to 150, you're not going to suppress testosterone production. Mm-hmm. Greater than 300, you're going to. So again, at that 25 mg tabs, 3 times a day to start, and back it down to 1 or 2 tabs per day for 6 to 12 weeks at a time. That seems to be the sweet spot where most of the bodybuilders that I've spoken to when I was overseas, remember, I didn't get much education on this here in the States. I got this in Germany and in Kuwait and so forth when I was overseas, okay? Now, I think I covered pretty much everything. Lastly, I forgot about this. When you're on an anabolic agent that is going to put your lipid profile in an unfavorable fashion, pretty much all of them do. I mean, a lot of them do. This was known for that. There's a product called Lipid Stable. Lipid Stable. You can Google search it. Lipid Stable. And it's a product by Molecular Nutrition, MN. And it's unique because it has vitamin E in it, niacin, selenium, pantothenic acid, green tea extract, garlic powder, inositol, and phytosterols. So it's a great product used by many people in the bodybuilding world who are doing anabolics. Again, lipid stable. It just helps protect your cardiovascular system from the dyslipidemia that's going to be incurred by the use of Proviron. Okay. Hmm. I think I covered everything here. Let's see here. Oh yeah. In addition, anytime you're going to go on these things, I always recommend as a sports med doc, you engage in a cardiovascular aerobic training program, and you use fish oil. Okay. And for some reason, the people that push the lipid stable product recommend 4 grams of fish oil a day. So cardiovascular aerobic training, lipid stable, which has the antioxidants in it, and 4 grams of fish oil per day. That protocol is supposed to be very, very stabilizing and protective of your lipid profile. Mm-hmm.